Hi. So I'm going to talk today about the importance of the feet and their relationship to the rest of our health, and especially our musculoskeletal health. When people come into my office, in my chiropractic office, they often come in with neck pain, back pain. Sometimes they'll have upper and lower extremity pain. But I always look to the feet because the feet are our mainspring. And let me explain what I mean by that. We are a series of springs, and these springs develop after birth. And normally in utero, when we're in the uterus, we have just a C curve. But it's not long after where we start developing the neck curve to suspend the weight of the head. And when we start walking, we develop the lumbar curve so that we can actually walk upright, and that supports the rest of the body. These curves, including the original one, act like springs when we walk. But our mainspring is actually the feet. And most people miss this. Actually, most practitioners miss this. They look at everything else, but they ignore the mainspring. So if you look at the foot from the top, we're going to flip it over. So we have actually three arches, not just one arch. This is the arch everybody thinks that is their arch, and they think that's it. That is the medial arch. And we also have one on the outside, and we have one behind the ball of the foot. So if we take a point from the heel to here, to here, to here, we actually have a triangular shaped spring, like a leaf spring. This spring keeps us balanced from front to back, so our core muscles and our postural muscles work together in harmony. Now, what happens in our society, because we walk on hard surfaces and we wear shoes, is that outside arch will break down first, and then the one behind the ball of the foot, and you might still look like you have a good arch, but your foot is not functioning normally. When that occurs, we actually lean forward. So this would be a normal stance, and with our feet break down, we actually lean forward like this. You couple that with having to sit in chairs on computers all day long. Many people do that, and you've got a formula for disaster. So I always look at the feet first. If the feet are not functioning right, the rest of the spine is not going to work right either. Now, Kelly's agreed to help me out here, and she's a patient, so I know she has foot problems that we've corrected, but we're going to have her stand up right now. Kelly, I want you just to face me. This is one of the ways I test the feet. We're going to test, not just testing the feet, we're going to test the core muscles first, okay? So let's put your arms out like this. Now, you're you're left-handed, right? Correct? Okay. Let's put the left hand on top. So I'm going to ask you just to resist when I push down, okay? Now, Kelly has her shoes off, so she doesn't have her corrective orthotics in. So we're going to test her core muscles right here. So go ahead and resist. Okay, resist. And she's having a hard time holding that up. She's allowing me to actually push her down. Now what I'm going to do, just with these tester orthotics, I'm going to give her that arch behind the ball of the feet, and I'm going to support these other two arches right here. And the reason she tests like that is because she is actually, got it? There. Okay, bring it on back a little bit. She's actually leaning forward. And when she leans forward, the brain shuts down some of the nerve fibers going into our core muscles so that we don't fall over, so we don't run into door jams. So let's go ahead and test you now. Hand there. Okay, now resist for me. Okay, so I can't budge her. You can see how quick that is. It doesn't take long. Well, these other curves that we have, or the other springs in the spine, have to respond to that because the core muscles need to engage. Many times I'll have people come in and they'll say, oh, I have weak core muscles. And I'll say, let me check your feet. When I check their feet, they get their core muscle strength back. So when you get your core muscle strength back and your spine is functioning like it's intended to function, all those other symptoms tend to go away. Hey, thanks for being here today. Next time I'm going to go over a foot scanner, a laser scanner, and show you how I use that. Thank you.